Welcome to TCU Pulse Check, the DNP Edition, your front row seat to the future of nursing leadership.
All right, welcome to TCU Pulse Check, the DNP Edition. This is a podcast from the TCU Harris College of Nursing and Health Sciences. This show highlights the stories, leadership journeys, and real-world impact of DNP-prepared nurses who are shaping the future of healthcare. Whether you're a student, a practicing clinician, or a nurse leader, this podcast offers insight into how advanced practice nurses drive innovation, influence system, and improve outcomes. I'm your host, Dr. Kimberly Posey, joined by my co-host, Dr. Paul Biluan. Today, we are thrilled to welcome Dr. Vicki Good, one of TCU's distinguished DNP alumni and one of the most influential leaders in critical care nursing today. We will explore her DNP journey, how her TCU experience shaped her leadership, and how the DNP opened doors to national influence. She is the Chief Clinical Officer of the American Association of Critical Care Nurses, where she provides strategic and visionary leadership for more than 110,000 members nationwide. She has held leadership roles in critical care, patient safety, administration, and education across major systems, including Mercy, Cox Health, Baylor, Harborview Medical Center, and Parkland. She's past president of AACN and a fellow in the American Academy of Nursing. She's widely recognized for her expertise in healthy work environments, staffing, patient safety, communication, and clinician resilience. She has received numerous honors throughout her career, including being named one of Becker's 50 experts leading in the field of patient safety. And we are so honored to have her with us today.
Thank you, Kim.
You're welcome.
Welcome, Dr. Good. Thank you, Dr. Posey, for this episode. We are so excited to have Dr. Good. I have a question for you, Dr. Good. What can you share about your professional journey and what ultimately led you to pursue DNP?
Yeah, so my professional journey started at TCU as an undergrad. So I'm a BSN graduate at TCU and started my critical care journey at Parkland Hospital in Dallas, doing the Parkland nurse trauma internship back many years ago. We'll just say that for now. And entered my leadership career very early in my career, probably way too early, but through a weird set of circumstances, got married and completed my master's degree when I was up in Washington State. And at that point was really focused more on the education front. And when I moved back to the Dallas-Fort Worth area, really expanded from education to providing leadership across all of acute care nursing with a heavy focus in critical care. But during that time, I got tapped on my shoulder and to go into a system-wide leadership role in patient safety. And that really started and sparked a great interest in me because I love culture and I love the impact of culture on everybody, the nurses, as well as the patients, et cetera. And so that really started my, I would say, formal leadership role. But I would say one of the critical taps on the shoulder I got was when I was in Seattle. A mentor tapped me on the shoulder and said, you can do whatever you want to do, and I'm here to support you. And so I think that is something that's critically important for anyone, is that we have to be looking to, tap shoulders of people and make sure that they know that they are material to go on and support them. Mentorship is just so critically important. So that's where I really started working with AACN at a national level. And while I was doing that, then I started looking at the board of directors of AACN. And so I applied for that while I was in Dallas-Fort Worth and actually got on the board of directors, which was really quite surprising to me because I was like, oh, they're not going to want somebody like me in that role. And so sure enough, I got elected. And the patient safety journey that I was on in my day job really led me to this whole concept of evidence-based practice. And how do we look at what the evidence says and put that into practice? And at the same time, I started thinking, okay, what's next on my journey? And so I started looking at PhD versus DNP program. and trying to figure out, okay, which one should I do? And interestingly enough, I was thinking about that this morning. When I was in my master's program, I was actually voted most likely to complete my PhD. And I laughed at all of them. I was like, no, there's no way. I'm done, finished with advanced education. And then next thing I know, I'm sitting there thinking about which one do I want to do. But I loved the impact of DNP because it's really taking that research that nurses are performing, but putting it into practice. Because when I started looking at that, it was taking on average 17 years to take knowledge that was generated in research and applying it to the clinical setting. And, to me, that was a hallmark behind patient safety. We weren't implementing some of the things that we knew were good practice. And so that's what led me to the DNP program. I looked at several different executive DNP programs and just kept coming back to TCU, probably because of it being my alumni. And then secondly, we had a strong program and I wanted to support that program. So that's what led me back to TCU for my DNP.
Thank you for that. And it is amazing, right, that 17 years from the time that research gets implemented. And that is what is so wonderful about the DNP role and how we can really move that needle quicker, right, to do that. So how did that TCU program and experience, did it shape your leadership path more? Were there other doors that were open to you because of the DNP?
Yeah, I think it definitely does because, number one, you're never an expert in your own back door, right? When you start to talk to people about what they need to do, but if they're in your home unit or your home facility, oftentimes people will negate that experience because you're just not the expert at that point. But I think the other thing is sometimes, unfortunately, clinical degrees open or close doors. When you say I'm an expert in this particular field, but you don't have the educational background to support it, you may or may not be heard. It's not everything. I mean, there are experts out there that don't have their doctorate degree, but I think it does open that door for you. And so that became critically important. And then I think the other thing is making sure that you're getting that DNP from a reputable university. So I, still look at where is that degree coming from. Some people say, oh, don't worry about it. Nobody will ever look. But I do. I look at that and I want to see that degree is coming from a reputable organization or a university.
Thank you, Dr. Good. What I picked up from what you said is education is really important and that the choice of where you go to is actually essential to your preparation as TNP because you're being prepared as an expert level nurse in clinical practice, and that's really important. For DNP prepared nurses stepping into leadership roles, what does authentic leadership look like in real practice?
Yeah, authentic leaders to me are the ones that walk the walk. You can't hide behind, the big credenza desk and, not be out there and truly understand, what your team is working on or doing. And secondly, it's how you mentor others and bring others on board on the journey. And so authentic leaders to me are those ones that are out there with their people and bringing them forward, giving them the tools. I say often, I've led many, many departments where I'm not the expert in that area, but what I am is the expert in leadership. I rely on them to bring their clinical knowledge, their skills of that area, and then I'm there to provide the leadership, the framework, and help to open doors and decrease barriers for them to be able to get their job done. An authentic leader to me is one that walks the walk, that allows others to make decisions, allows others to succeed, and mentors them along in that journey. To me, that sums up what an authentic leader is.
Thank you, Dr. Goodham. And I know that on the healthy work environments, it is really rooted in that authentic leadership and those standards. When the organizations are looking on implementing those or looking at that as something essential for their organization, what would draw them to use it? And where do they struggle the most when they are trying to get this started and implemented?
Yeah, the healthy work environment standards that AACN developed came out 20 years ago. They came out almost simultaneous to when I was going into the patient safety world. When they came out, I looked at them and I'm like, oh my goodness, this is how you redesign culture. And culture is one of the critical things that leads to many safety events in the hospital setting. So looking at those standards, I became a advocate for those standards from day one when they were released. And I've continued over the last 20 years to pull those standards in, lecture on them, use them as a framework for all of my work. And I often say, they're really good standards for just day-to-day life. I often say they could be used for marriage counseling. I mean, they are really that backbone of how you should behave and treat other human beings. For the listeners that don't know, let me just run through real quick what the 6 standards are. And it starts with skilled communication. How do you communicate with one another? Communication still remains the number one cause of sentinel events in the United States, which seems crazy. By now, we should figure out how to communicate with each other, but it still remains the biggest struggle among humans. True collaboration. How do we work as a team? It is so critically important to work as a team in all clinical settings because the patient needs every one of us in complete harmony. Effective decision making. And to me, effective decision making goes back to that authentic leadership. How do we invite all people to the table to make those decisions? So it can't be just one person making decisions. Appropriate staffing. That is critically important no matter where you're at. And it goes way deeper than numbers. It's, do I have the right resources? Do I have the right support personnel? And then am I matching the needs of the patient to the needs of the nurse? How does that become a symbiotic thing? The needs of the patient must drive what kind of nurse takes care of that patient. Meaningful recognition. We all strive to have people recognize us and to be valued in the healthcare system. And so, what does that look like? And part of the challenge with meaningful recognition is it looks different for every single one of us. So, meaningful recognition to me may be something totally different to the two of you. And so, we have to learn, what do our employees value as we set out on that meaningful recognition track. And then lastly, authentic leadership. The one thing that people often look at that and go, oh, well, that standard is for the leaders. Well, I reframe it and say every single one of us is a leader. And so as a nurse, you are a leader, whether it's you're leading your patient, you're leading your team that you're with, or if you have a formal leadership title, all of us are leaders. So how do we authentically lead from our seat, on the team? So those are the 6 standards. Through our many years of research, I think the two that tend to be most challenging for individual or for teams is one, meaningful recognition, which is always surprising. People are like, well, we have the DAISY program. We have a meaningful recognition program. But again, that doesn't necessarily speak to every single person. And when we've done some focused research on that particular standard, what we found is people say, I just want to be told on a daily basis I'm doing a good job. I just want those simple pats on the back. And, formal recognition programs, whether it's DAISY or something else, provide that one-time call out or, when you get a nomination written. And so what we see missing most of the time is those really small recognition programs that are so meaningful to people. Now, not to say we've got loads of research on the incredible, vast importance of the DAISY Award program and the incredible outcomes it has generated. So I just want to make sure I say that because the Barnes are true friends and colleagues of mine, and their program is just absolutely amazing. The other standard that we see most of the time that people struggle with is appropriate staffing. And I think the reason is we don't take that time to have that meaningful dialogue about what is staffing. Sometimes we get at a crosswinds with one another. It becomes a we-they conversation instead of a team conversation on staffing. So how do we bring that staffing conversation back to a team-based conversation where we really hear each other of what each other needs. So, both from an administrative standpoint, we have to understand what the direct care nurses need, but the direct care nurses also need to understand what are the constraints that we're working within. So we both have to come together to really truly understand and appreciate and make sure we're getting the right staffing to those patients.
I've learned a lot from everything that you said, Dr. Good. As a nurse who used to work in different ERs, or traveled nurse too, I think those are really important points that leaders should learn from. Because a lot of our nurses in the front lines, he said, we are all leaders. Nursing job is getting exhausting, not because of the workload, that's probably a factor, but also because the healthcare is becoming increasingly more complex. The ability of nurses to provide care needs to be evolving all the time, but also that causes strains on individual nurses, which affects their performance. And we know that when nurses are exhausted, tired, safety issues increase. But thank you for highlighting that out. And I would really love for our DNP students to learn from that, especially those that are in the executive leadership track, so they can impact change when they become leaders or when they're back in their practice. What advice would you give to our DNP students in TCU and everywhere, to use their degree to create meaningful system level or even national, international level change?
Yeah, that's always hard because you feel like you're, facing this gigantic elephant, right? And it's like, okay, well, how do I start making a difference in this big world that's out there? And I go back to a quote from Martin Luther King. And so when we're president of AACN, we pick a theme each year that we kind of ground ourselves in that theme for the year. And mine was step forward. And the reason was I wanted to encourage people to get out there and make a difference. And oftentimes you become overwhelmed when you think about, okay, what can I do to contribute or make a difference? But he said, you just need to take the first step. You don't need to see the entire staircase when you start talking about change and impacting other people. So I say, take that first step. And sometimes that's just a local step. Is there something you can do on a local level? What impact do you start making within your own organization? And then start peeling the onion back and thinking about, okay, what can I do next? Can I go present at a national conference? Can I publish? And oftentimes you think, oh, nobody wants to hear what I have to say, but we do. And we need to hear all those different perspectives. So how do you start to disseminate your knowledge on a grander scale? Think about what you can do to contribute to things like, being on boards. There's a whole Nursing on Boards coalition. The NOBC publishes routinely opportunities for nurses to come onto boards. And whether or not that's a community board, I just concluded last year being on the Child Advocacy Center board for my local here in Springfield board, or whether it's a national board, either way, you're making an enormous contribution to your community. So look for those type of opportunities. But you're going to have the skills coming out of that DNP program to do these things. Now it's up to you to apply those skills and just take that first step to do that.
I have a
Yeah.
follow-up question to Dr. Good, which just suddenly went through my head right now. I'm going off script, but a lot of emerging leaders and also with our DNP students, we are all plagued with imposter syndrome. Can
Yes.
you tell me about imposter syndrome, your experience about it, and what can you advise emerging leaders who are being plagued with imposter syndrome? Before we apply for boards, we're always feeling like, am I deserving to be in this board in this first place? Like, what are my credentials to support that? It is a very common thing for emerging leaders and probably for seasoned leaders as well. So tell us
Oh,
about
yeah.
it.
No, I still have imposter syndrome. Last year when I got the letter saying I was being inducted into the Academy of Nursing, I was like, oh, they got the wrong address. We need to send this back. So it is true. I mean, you have to just develop that confidence that you really do have this knowledge, and you really have to think about that and just move past it. And I don't know what the advice is, because I still to this day experience it. I listen to what I've done on my resume and I think, no, that's not me. And I'm like, oh, yeah, I did do all that stuff. So it's just take that leap of faith and trust yourself is the bottom line. You just have to do it.
I'm so glad you brought up imposter syndrome because that's exactly what I was going to say. Because, you made me think of it, Dr. Good, when you were talking about when you ran for the AACM board that, oh, they're not going to want me. That was like the classic imposter syndrome. And I agree. I think we all go through this, no matter if we're a new graduate or we've been around the block, right? I think we all experience some of this imposter syndrome. And I think that's why important, going back to also what you said, is having someone tap you on the shoulder. That is so important when you hear from, your mentors saying, I believe in you and you can do this, right? And how many of those mentors affected your career and brought you to where you are today. And I think that Dr. Biluan, we both can say we've had plenty of those mentors tap us and help bring us along the way. So again, think that's all just, believe in yourself, that take that step. You don't need to see the staircase. Peel back the onion. These are all great little tidbits of things for our listeners to take with them, that it's important as they move through their career, that you just have to, go out there and give it a try. And as we think about just DNP practice, if you think about maybe when you graduated from your DNP program to fast forward to today, and now we're looking forward towards the future, what do you see as a vision for DNP practice and for the next generation of our nurse leaders?
Yeah, I think the next generation is going to be very interesting because for many of them, they don't see boundaries, which is awesome because I think it is going to continue to take our profession, further and further. This past year has been challenging for us as a profession as we faced, different scrutiny. And what we're seeing is that younger voice is coming out, which is so impactful. Across AACN alone, we're seeing that our younger generation nurses are some of our most active members right now, which has traditionally not been the case. So they're bringing a lot of energy with them. And that next generation is really going to need to be those key influencers in the healthcare setting to be able to take that research that's been done and get it implemented into practice. The practice of nursing is evolving so quickly that if we don't get that knowledge implemented, we're going to be in a world of hurt, quite frankly, for both our nurses and our patients. And so we've really got to get that done. So I see that gap narrowing more and more on how long it takes us to get from knowledge generation to dissemination or into practice implementation. But, my vision for the future is we will never hear, we've always done it that way again. That is, to me, the most detrimental phrase of our profession. And it's one that I've always struggled with. And I probably challenged it way before my time because I never like to hear that. I always want to hear, okay, how can we do things differently? How can we look at a new way and a new avenue to address these challenges?
Yes, thank you for all of that. It has been really amazing hearing about your journey that you've had from when you started out as president to, now being really this expert on this healthy work environment and the work that continues on. I just love to see how those healthy work environment has just morphed right into where it started, like you said, 20 years ago, and today being used in so many different settings, and how it's really shaping patient safety and really our nurse and their environment, and making them feel more welcomed right into their setting. So we really, again, want to thank you. It's been a privilege to feature your journey And for our listeners, we really thank you for joining this episode of TCU Pulse Check. Be sure to subscribe and also stay tuned for more conversations with leaders like Dr. Good who are shaping the future of the DNP. Thank you.
Thank you.
TCU Pulse Check, the DNP Edition, takes you inside the heart of advanced nursing leadership, innovation, and impact. Hosted by DNP faculty Dr. Kimberly Posey and TCU DNP graduate and innovator Dr. Biluan, this podcast explores the evolving role of the doctor of nursing practice in shaping healthcare systems, driving policy, and transforming patient care. Each episode features conversations with nurse leaders, faculty, students, and alumni who share their journeys, insights, and lessons learned along the way. Whether you're a prospective student, current DNP, or a healthcare professional, join us for authentic discussions that spark ideas, inspire leadership, and keep you connected to the pulse of nursing practice.